Hey, my name is Adamkiewicz. I'm a pediatrician from Atlanta, Georgia. I've been here for 3 days now, and it's very hard to explain what's going on here. First of all, the question is about children. So I've been here long enough to run around on the wards, as well as spend some time in the emergency room. And definitely the majority of people have signs of malnutrition, both the adults and the children. Many children are passing out literally during the day and injuring themselves. Particularly difficult to see are pretty much any child with a chronic illness, whether it's a heart disease that remains unrepaired because they cannot leave to get heart surgery, or conditions like celiac disease, or conditions like muscular leukodystrophy. These children are suffering extremely severe malnutrition because there's a combination of chronic illness and malnutrition, as well as regular children. And my colleagues, pediatric colleagues, have not eaten for days. I mean, they're gaunt. They haven't eaten. But yet they're incredibly resilient and doing amazing work. The prices here are absolutely crazy. 1 kilo of meat or sugar costs the equivalent of $100. So if people are saying that there is plenty supply of food, that does not explain these absolutely crazy prices that people have to endure. And most people can't afford this. So this is an absolutely inhumane situation. But let me just mention why this is happening. And I am a pediatrician. I'm not a trauma doctor. My colleagues here and part of the mission are trauma doctors, and I'll let them speak. But they see things that are incredible. And just walking into the place where we sleep, we pass by the emergency room, and I've seen with my own eyes boys, 11, 12, 13, having massive bullet wounds. One boy had a bullet wound that went from the hip through the spine, out of his clavicle, transecting his spine, making him paralyzed. This is a child of a staff person from the hospital, okay, who has already lost children. This is an absolute lie. This is absolutely not true. Because I've seen that with my own eyes. And I would like to have Mr. Whitcock come here and talk to me to my face, and I'll show him, okay? Mr. Whitcock, just come here right now. In fact, I'll meet you in the deconflicted area outside of the hospital, and I'll escort you into the hospital. If you arrange a deconflicted area, which is not far away from where you are, I'll meet you there in person.